The five that I would look at for the benefit of regenerative medicine or stem cell therapy. Number one, fast healing. Sometimes we get to the point where we can't heal and we need to heal faster or better. So it gives you the ability to heal faster. Now, also what it does is if you're looking for like reversing like arthritis. So when you think about that loss of cartilage and that tissue and you start getting bone on bone, well, you have to regrow that tissue to get that space back in that joint so you don't go through that arthritic kind of pain when you have it in the morning and you're aching when you're walking around. So it reverses that. Another thing is anti-aging. So we are going into the world of increasing our age, our active lifestyle. So because of our cells, knowing that we have to have that right signal, and if you don't have that signal, well, that's why we go through the aging process. So regenerative medicine increases the longevity.
Welcome to Entrepreneurs Are Leaders podcast with Harry Sardinas. Interviews with world's most influential entrepreneurs that share tips about how to grow your business exponentially. Charismatic speaking, leadership, branding, marketing strategies designed to help you monetize your knowledge, find true happiness, and manifest your goals and dreams.
What are the five main benefits of the stem cells treatment? Today we have Dr. Tommy Rhee with us that we can say is a serial entrepreneur because he has more than one business. And he has been practicing chiropractor since 2006 and several as the official team chiropractor of the Tampa Bay Buccaneers from 2015 to 2018. Oh, wow. So Tommy is a sport chiropractor and pioneer in regenerative wellness, has dedicated over 3 years of development of Regeneration, which is actually the founder and recognizes limitation and risk of injection-based stem cell therapy. So, doctor, tell us, what are the five more biggest beneficiaries of the stem cell therapy?
All right, thank you very much. So the five that I would look at for the benefit of regenerative medicine or stem cell therapy. Number one, fast healing. Sometimes we get to the point where we can't heal and we need to heal faster or better. So it gives you the ability to heal faster. Now, also what it does is if you're looking for like reversing like arthritis. So when you think about that loss of cartilage and that tissue and you start getting bone on bone, well, you have to regrow that tissue to get that space back in that joint so you don't go through that arthritic kind of pain when you have it in the morning and you're aching when you're walking around. So it reverses that. Another thing is anti-aging. So we are going into the world of increasing our age, our active lifestyle. So because of our cells, knowing that we have to have that right signal, and if you don't have that signal, well, that's why we go through the aging process. So regenerative medicine increases the longevity for the active lifespan. Four, what's really important is the thought process, how to think, how to make yourself like more cognizant of your surroundings. It gives you clarity. It gives you more of a sense of like that nerve function to decipher and to be problem solving in a faster method. And I think the last thing is that overall wellness. Overall wellness to keep your healthy cells in its information state activated. So it's a well-rounded type of therapy for everybody out there.
I'm so happy to have you here because, I've been playing tennis all my life. And lately I'm playing tennis and I have pain in my elbow, pain in my knees. And I'm like, how come this has never happened to me? I'm remembering that I play sometimes when I'm being younger and I'm doing the same thing. I never have pain in my knee or in my elbow, and now every time that I play, I feel this pain, and sometimes last few days, especially now the arm, right? So why this is happening, and is that technology can help to the pain that I actually have because of my tennis playing at my
Yeah,
age?
yeah.
I'm
So
getting close to 50, 49. I'm
yeah,
49 years old.
welcome to the club. I'm 58, so you're almost there. Here's the thing. When you are doing an activity all your life, you create that thickness in that tissue that can handle that load. Now, when you look at someone that wants to go into that sporting event at a later stage, you're asking those tendons and ligaments and muscles to be strong. It has to build up to that point. So when it starts, going to a workout phase and you break down that tissue, you need that time to recover. The recovery is important. You have to get those cells to rebuild stronger and better so then you can go play again. Well, because we age, we go through that process of not having that signal that tells our existing tissue to regenerate, to do its job. So that's why it's tougher for us at this age to regenerate because we lose that signal. If we can get that signal in its
And that's
clearest
always I
form,
have pain, right? That's the reason that every time that I play, I have pain, right?
yeah,
Correct?
yeah, because you don't have that right signal to get that tissue to regenerate, to get that tissue strong enough to handle that playing ability. So it's all about getting your body back to square one, to 100%. And that is because our cells are sitting there waiting for that information to go.
Because doctor, the pain is the signal that something is wrong, right?
Yeah.
I
It,
went
it,
to the pharmacy. I went to the pharmacy and said, "Look, I have pain here in my elbow because I'm playing tennis, and I have pain." And you know what they told me in the pharmacy? I said, "Well, don't play tennis then." I
Hey,
said, "Well,
here's the yeah.
I
So
need a
here's
better
a
solution because I want to keep playing."
Yeah, here's a funny thing about that. So when you go in the pain cream and the pain reduction, they just address the pain, so they mask the pain. They numb the area, but you still have the damaged tissue. You have to go to the source. That's what's really important. So that signal, you can't avoid that. You have to say, hey, what is really going on? And that's why you have to think about not masking the pain, but really going into the solving the problem.
Yeah, I even have a friend that is using some balm that they apply maybe to horses to, and he's telling me, Harry, this is amazing. You have pain, you put this thing, and you're not gonna have pain anymore. But yeah, that's the thing. Of course, if they use it for horses,
You gotta be careful.
clearly is is like like an anesthesia, right? Of course, you're not gonna have pain, right?
Yeah.
But the
Yeah.
damage is still there, right?
Exactly. That's the danger. That's why you hear about these professional athletes when they're injured, they can still play in that season. But then after the season, you hear them doing a surgery. They have to do some type of aggressive rehab because they damaged tissue so bad, they need to do constructive surgery to fix it again. So that's why you want to avoid the masking and listen to the signal, the pain signal saying what is really going on and decipher what is the tissue that's compromised and getting that right information to solve that problem.
So, doctor, then would be a good idea, for example, that your product, right, that you have been actually using with the professional athletes, right?
Yes.
To someone that is not like professional like me, but also that goes to is about hit the 50. And I play a lot of sports. I dance a lot, and I play tennis a lot. And lately, the like I said, new pains that I never had before has arrived, and something that I always have been doing all my life. I recognize it's not like a professional athlete. So sometimes I play tennis for a year or two after I stop because I'm traveling, I'm doing this, and then maybe after 2 years, then I start to play again. And then now when I started to play again in Florida, actually, it's good weather. This is new pain happened to me, and this is something that I'm dealing with that I never had before. And
Yeah.
I'm shocked. I don't even know the thanks so much for the explanation because I didn't have any clue what was going on. I'm thinking what's wrong with me.
hmm
And
So,
the
yeah. So when you have professional athletes that do this type of therapy, they know it works, and then the results are there. The problem is that when you do a stem cell injection, there's a downtime. So athletes don't want to do it during the season. They rather mask the pain and then deal with it off season. So these athletes that do this topical application, they get great results. Now, here's a good thing about these test subjects, these athletes. They push themselves very hard. They beat themselves up. And when you see the results come back from them, then you start asking yourself, if it can work for athletes working that hard of a workout or that game or that event, it's going to work for people like us, everyday people that play tennis and play sports or work out. Because in our world, we don't go that hard. We don't go 100% and try to destroy our body from a sporting event. We just play to enjoy ourselves. So, because of those test subject athletes, it works for them. it's going to work better for us because we don't do that aggressive stuff. So when you're at that age that we don't have that signal, that stem cell signal, it gives you the ability to regenerate to get you back to your playing ability. So it's a fantastic testing ground for athletes that can apply to us.
But also, you see, the other day, someone was telling me, Harry, if you're about to hit 50, you need to do some body weight, you need to do some muscle beast, building muscle exercises. Not only I like more aerobic exercise, like dancing, playing tennis, this and that. So lifting heavy things is not my thing, but you can tell because how I look. But the
No, you're good. You're good.
the problem is that how I'm gonna do these exercises if I have pain in my elbow. You see, I'm thinking if I do this exercise and I start to lift weight and I have pain in my elbow or in my knees because of the playing tennis and things like this, I think if I do heavy lifting, I'm gonna injure more the knees and the elbow. So a cream like yours would be really helpful, right?
Oh, absolutely. You're talking about you have to speed up the healing process, right? You're at that age where you, again, about the signal. You don't have that strong signal as if you're 20, 30 years old. At 50, that signal decreases. So you need to have an introduction to that damaged tissue in the form of a brighter, stronger signal that you have. Just like you hear about people doing like testosterone therapy, right? They do therapy for hormones. Well, because we decrease our hormone production, so we need to introduce it to another signal that has that hormone signal. So it's the same thing. Our body needs that, and we deplete that because we age. So to replace that, we do that ability to do that regenerative stuff.
Now, doctor, educate us a little bit more about the stem cells because you hear out there, some governments allow, some governments don't allow, some people forbid, some people not. Uh, can you educate us a little bit more? What is it and what some government have concerns with this and
Mhm.
why? And then what is the position in United States in all that debate that we have around the stem cells?
Okay. In the United States, there is a rule or a law that says you can't harvest stem cells, meaning that you can't take it out of some other body and then put it into like a petri dish and then grow it and then inject it into your body. So they
Oh wow,
prohibit
this is
that.
possible.
Well,
Wow.
you can do
Ah,
it, but
wow.
it's prohibited in the United States. So there was this company called Regenix. This is back probably maybe 10, 12 years ago, where they used to take your own, human tissue and they would grow it in a laboratory petri dish, and then once it grows, they re-inject it in your area. So the FDA shut them down. They said you can't harvest tissue, so they don't allow that. So because of that restriction,
Why, doctor? Why harvest tissue could be dangerous, and what is the concern of the government?
I think the big thing is that there's not much research behind doing that
I understand.
procedure. You don't know what that tissue may grow into. It may grow into like a tumor cell. You may have some type of odd formation. So when you think about
Mm,
way back in the day, remember that sheep called Dolly? They did the cloning and they took the DNA from a sheep and they made it into another sheep, and then that sheep lived half the life and passed away for cardiovascular reasons. Well, because of that starting point and that end point wasn't as normal as it possibly could be, so they had dangers on that fact. So they don't want to go further into it until they can figure out the real regulation behind that. So right now with stem cell therapy, regenerative medicine, it's about these things called mesenchymal stem cells. You can obtain that from your own body tissue, or you can get it from the umbilical cord, they call Wharton's jelly. That gelatinous material has that mesenchymal stem cell, and that's what they call the pluripotent, the
ah,
potential
wow.
the potential to turn into that cell. Well, the problem is that that cell has a nucleus, like a DNA and chromosome, and you don't know what it's going to turn into. It tells you it's going to turn into a tendon, but how does it do that if it doesn't have the same genetic coding as your body? So when your genetic code has a different set of codes and you have this donor tissue different set of codes, how is it going to match? So it doesn't do it. So that's when you hear about these things about live stem cells. It doesn't matter about the live stem cell. What it matters is what it secretes. It's the information that these cells give out. It's what they call the extracellular vesicles. That's the information. The neat thing about that, it's cell-free. There's no nucleus, there's no DNA chromosomes. There's not going to be a formation of tumors. It's just going to give the information to the existing tissue you have with the problem, and it's going to tell that cell, do your job, do what you're supposed to do to regenerate. And that's where the future is at. It's that cell-free bioactive biomolecules that are coming from those cells. So that's what I looked at, and I said that's a better type of tissue I want to go after because there's no tumor formation and it's a smaller molecule, so I can get through the skin into the deep tissue. And that's what I'm excited about the future of this whole cell-free world.
So basically, the so what the product, doctor, is what you have is a cream, right?
Yes.
Okay. And that cream you started to develop in the past 2 years, correct?
Yeah, so I've already developed that from a human tissue source. Yes.
Oh wow. So how this development goes, like, so real, so because is a cream, it doesn't matter, it could be from, it's from a real human source, correct?
Yeah, so you have a cream that has a base, and the base is where you want the tactile feeling and the scent and everything, right? In there are going to be small EVs, extracellular vesicles that have the signal. And then inside there is going to be a transdermal agent that makes it go through the skin. Because you can put a cream on your skin, but it won't penetrate through the top layer called the stratum corneum. You have to get it through that thick layer. So you need an agent. There's an agent inside my product that gets it through the skin. So because of that, it's a class 3 classification. It's called DMSO, but it does the transdermal. It gets that small molecule through the skin into the deep tissue. Well, the problem with that is that it works, but I can't sell it directly to consumers because of the drug classification. So it has to go to a provider and they can dispense it to other patients. Now, where the trend is moving is from the
Oh
humans.
wow, what that means, that you cannot sell it directly to consumer.
No, it has to go to the
Have
doctor
to be
first. Just like a,
ah.
yeah. So now what I'm doing is that we are formulating a new format to sell directly to consumer because the signal that I looked for from the human tissue, there's similar signals from plants. Now, when I look at plants, now I can go to OTC, over the counter. I can sell it directly to consumer because it's about the signal. It doesn't matter where it's coming from as long as the signal is equivalent. And then when the signal is there, now we can go ahead and give it to the patient directly, more cost effective, safer, of course, and it's easier to use. So that's what I'm excited about. So Regen is moving
Wow,
from
cost
human tissue.
effective. I like what I hear. So tell us a little bit more about cost effective. So is it come direct to consumer? What, how much the consumer are, will be the final product that I suppose will be in your website, right?
Yeah, so right now the human tissue kit costs $1,000, right? Because of the donor site and the process to get it into the topical application. Well, now it's going to have the same signal, same ability, but now it's going to cost you around $91. That is a big difference.
Wow,
Same
cream.
potency, and it's more too. The other one has about 30 milliliters, where this one will have about 100 milliliters. So you have almost triple the amount. And triple the amount means that longer duration, cheaper cost, same ability, same strength, and same outcome.
So tell us about your book, why you decided to write this book.
Okay, so the book was, here's the thing. So I have to explain about stem cell therapy, the different kind of stem cells, and the future of where stem cell therapy is going. Well, I kept on saying it over and over again. I said, well, let me write a book, a short book, a 100-page book that explains everything that's involved with regenerative medicine stem cell therapy. So in the book, there's two versions of it. There's the one that you can follow the science side of it. You can look at all the cytokines and the information and all the actual, the high-tech words. Or you can go follow this guy named Jeff and his journey into discovering. Jeff summarizes what the science guys are talking about so you can easily follow along without being lost. So that's what's fun about this book. It's only a 100-page, fast, easy read, but it talks about everything from the stem cell world to the injectables to the topical and the future, which is cell free.
So, doctor, if someone is in love with this conversation, how they can find your product, how this process works,
Yeah.
and when you launch the new one and it's ready to consumer, when how we can know more about it.
Okay, so the fastest way to get to know about the product is go to my website. It's RHEEGEN.com, and you can learn about the human source of that particular product. And then as far as the new product that's coming out, we're in development, we're testing. FDA, you have to do a lot of tests. So we're in the testing phase, and we're hoping it's going to be right about November-ish where it gets accessible to the public. So I will give you more into that answer as further along we get to these tests.
Oh, this is what we can do. Do you have you can when you're gonna launch it, come back to the podcast, just book, and then we will happy to have a second interview for your product launch, which
Oh,
is I'm
100.
a big support I'm a big supporter of the product because I have the problem myself.
Hey, 100. That
And
I was.
everybody with 50 years old, we have the problem that play some sports. So we
Yeah,
would love
think.
to have you back to learn more about it, correct?
Yeah, it's not just anybody that's at 50 with sports. It's think about arthritis, people with like back pain, knee
Ah,
pain, that just
wow.
anybody with those kind of repetitive or that chronic pain, that you're the ideal person. We
Mm.
all have
Even
pain.
if
It's
they
just
don't play sport, right?
exactly anybody because you know sitting a long time and standing up, there's pain in there. Well, that's because you're going through arthritis or the
Yeah,
arthritic
I've been
degenerative.
advised to do some exercises because I'm sitting a lot, and now my shoulders are going a little bit front like that, so I had to do some exercises to keep my posture straight to avoid pain in the future. I've been told.
Yeah. But when we were younger, we can get away with a lot of that bad posture or lack of exercise. But now when we get to this age, we have to stay active because it's good for your cardiovascular system, it's good for your overall health. But the problem is that you have joint pain. So it's like I can't do this because of that. So you have to fix that
Yeah,
pain to get
exactly,
you
exactly.
healthy.
Yeah, yeah. Like for example, they would tell me, Harry, you have to lift some weight. I'm like, how come I gonna lift some weight? I need to rest my shoulder. So we're gonna play a game, my elbow. So when like for example, I'm playing Friday and the weekend, okay, and then if somebody invite me to play on Tuesday, I said, no, 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 no. I'll need to wait until the weekend to wait until the pain goes slowly. Then we play in the weekend. So I had to give 1 week rest to my elbow in order for that to work. Okay. So thank you, Doctor. This has been amazing. I think your product can help a lot of people, right? And even if they can even combine with some exercise also, that will also help them. But you are the doctor here. I'm just, but stay active is a great tip. The
Absolutely.
great tip. I'm trying to be active as much as I can. Thank you so much. And for all of you following the podcast Entrepreneurs and Leaders, see you in our next episode how amazing entrepreneurs like Dr. Tommy Rhee have business that make the world a better place. Bye for now.
Follow us for more on charismatic speaking, leadership, exponential business growth, branding, marketing, strategies designed to help you monetize your knowledge, find true happiness, and manifest your goals and dreams.